Degenerative joint disease or osteoarthritis.
Osteo means bone, and arth refers to arthron, which means joint, and itis means inflammation. So, osteoarthritis is a disease involving inflammation of the bone and joint cartilage. Someone thought that the itis part of the osteoarthritis was a misnomer, and that inflammation didn't play a role of this development, and that was mostly degenerative disease resulting from simple wear and tear. Now stop that thought. Inflammation doesn't play important role of the development of osteoarthritis. Alright, healthy joint consists of two bones. Each of the tone layer articular cartilage, which is the type of connective tissue that allows the two bones to glide in each other, essentially without friction. With osteoarthritis, we're really talking about one particular kind of joint, which is synovial joint. Along with the articular cartilage, another important component of synovial joint and where the name came from is the synovium. Along with the surface of articular cartilage, forms the inner lining of the joint space. The synovium consists of connective tissue, blood vessels, lymphatic vessels, and the surface type A cells that clear cellular debris, and type B cells that produce component of the synovial fluid, which helps to lubricate the two articular surfaces. Where the main issue of osteoarthritis is the progressive loss of this articular cartilage, which means not much separating the two bones anymore, which adds significant amount of friction between them, which then generate inflammation and triggers pain to the nerve endings of this joint space. The articular cartilage is the chondrocyte cell, a specialized cell responsible in maintaining everything cartilage related. It produces a strong gel or extracellular matrix, which contain type 2 collagen, a protein that provides structural support, as well as proteoglycans, such as hyaluronic acid, chondroitin sulfate, and keratin sulfate. All these extracellular components give the cartilage elasticity and heighten cell strength, which help weight-bearing joint distribute weight such that underlying bone absorb the shock in weight. And this joint in knees, hips, and the lower lumbar spine. Okay, so chondrocytes are important for the articular cartilage. In healthy people, chondrocytes maintain the delicate balance between breaking down old cartilage, called catabolic activity, and producing new cartilage, called anabolic activity. Through the use of both the degradative enzymes and synthetic enzyme, when something causes increase in expression of degradative enzyme, then the balance tips start to that loss of cartilage. What sort of something causes the increase of degradative enzyme? Well, that's $1 million question, right? And the answer is straightforward. Factor for osteoarthritis seems to be age. Often the bone degrades over a long period of time. As mentioned earlier, inflammation also seems involved, and there are a number of pro-inflammatory cytokines like interleukin 1, interleukin 6, and the tumor necrosis factor, Increased metabolism, which involve blocking the new formation of cartilage, means decrease in anabolism. Also, joint injury which bring to an inflammation, which seems to major risk factor of osteoarthritis, as well as mechanical stress and obesity. Other risk factors include neurologic disorder, genetic factors, and medications. Whatever the initial cause of articular cartilage damage, I guess the chondrocyte trying to repair the cartilage. It initially started making less proteoglycans and more type 2 collagen, but soon switched to type 1 collagen. Unfortunately, type 1 collagen doesn't interact with proteoglycans in the same way. It decreases elasticity in cartilage, allow it to break down. Eventually, though, over the course of years, chondrocytes are able to give up and become exhausted and making undergo apoptosis or programmed cell death. The cartilage becomes softer, weaker, and continue to lose elasticity, and it starts to flake off in synovial space, called joint mass. A type A cells in synovium attempt to remove the debris. Immune cells like lymphocytes and macrophages are recruited at synovial membrane, which produce pro-inflammatory cytokine that ultimately cause inflammation to the synovium as well, called synovitis. Also, fibrillation from is essentially this crack. The cartilage will continue to roll away until the bone is exposed, allow it to rub with the other bone, which causes bone hibernation, making it look like polished ivory. Finally, the edges of the bone grows outward called osteophyte, which make them joint look wider, something that most obvious when seen in the distal and proximal interphalangeal joint, or the finger joint, called Heredin nodes in distal and Bouchard nodes in proximal joint. Arthritis is really common, and we know people suffer from it. People with osteoarthritis often feel stiffness in the morning that lasts less than an hour and back at the end of the day. This is an important difference in rheumatoid arthritis, an inflammatory disease that also affects the joints. In this disease, stiffness usually lasts longer than an hour. The pain in osteoarthritis is sharp ache, burning sensation, which also gets worse with prolonged activity. Usually, the joint don't swell, while in rheumatoid arthritis typically involve painful swelling. The treatment of osteoarthritis involve non-pharmacologic approaches, like losing weight, moderate exercise, as well as physical therapy. This could be especially important for large weight-bearing joints like the hips and the knees. Pharmacological treatment focuses on reducing pain and inflammation. If neither this approach is successful though, sometimes patients may benefit in injection of hyaluronic acid in the joint or they may surgery to replace the affected joint.
Nursing diagnosis. Acute or chronic pain related to bone deformities, joint degeneration, muscle spasm, and physical mobility. Impaired physical mobility related to muscle weakness, pain, stiffness, and restricted joint movement. Activity intolerance related to decreased muscle tone and joint pain. Nursing intervention. Assess the client's description of pain. Assess the client's previous experiences with pain and pain relief. Assess the physical activity level and mobility of the client. Assess the client's nutritional status. Use adaptive equipment as indicated. Encourage active range of motion exercises. Encourage the patient to participate in planning activities that gradually build endurance. Administer medication as prescribed. Prognosis. Patients with osteoarthritis depends on which joints are affected, whether or not they are causing symptoms and impaired function. Some patients are unaffected by osteoarthritis, while others can be severely disabled. Joint replacement surgery for some results in the best long-term outcome.